to another Wellness Wednesday. Wendy Bell, Alexandra Dubiak. You know what? We've talked about this for a long time, but this is a very significant day for you at Advanced Integrative Medical 360 because you've been working and focused on this for so long. Take it away.
Yeah, this is so fun. This is all about skin, which there's so many different things that can go wrong with your skin. And we see tons of patients all the time that come in with multiple skin issues and they've been through the gambit of treatment. And so skin is fun. Skin is hard, but skin is fun. So the topic today is just about skin health issues that are not being addressed elsewhere. We have so many patients day in and day out that come in and they say, I've had acne, since I was a teenager, and they're now 40, 50 years old. I have psoriasis, I have eczema, I have rosacea, I have all these different skin products or all these different skin issues. And it's never been, it's been addressed, but they've never had any resolve from it. So that kind of goes into your typical treatment modalities. So most of the time, patients will go and see a primary care, they'll go see a dermatologist, and the treatment options are antibiotics. They can be topical, they can be oral forms. Birth control is a big one.
Sure.
We know that because
for acne, for sure.
Hormonal, skin problems, birth control is a really big one, which goes back to that segment about birth control and what it does to your hormones. And then other prescription medications. So steroids are very common, oral and topical steroids. Accutane is common. I'd say it's pretty common. I feel like it should be less common because it's a terrible medication.
Right, no, I know.
It works, but there is a huge black box warning with Accutane that, if you're a female of reproductive, absolutely cannot get pregnant on this. And they have to have, serial pregnancy tests. It's crazy. And then spironolactone, which we've heard of too, which is a medication in the cardiology world, but they also use it for skin problems, specifically acne.
Now, before you move along, why did you guys, so when I think about Advanced Integrative Medical 360, I think about hormone-based weight loss. I think about getting in touch with this blood work that you guys do that opens the door to this roadmap of what's going on with your hormones and these biomarkers. Why make the leap to skin?
In terms of treatment?
Yes.
Yeah, so because skin is a big deal, because skin is so a huge problem.
It is such a big deal.
And there's no one size fits all answer for that.
Right.
So you have to dig a little bit deeper to try to figure out what the problem is, because otherwise, these are antibiotics and steroids and things. They're good treatment options, and sometimes we have to use those things to calm down symptoms.
Band-Aids.
But it's a Band-Aid unless you know why that's happening. It's just a Band-Aid. So there you go. So
I love it.
This is really exciting that we are coming out with a new skin division, and I am going to be in charge of that, which I love. So couple things listed here, multiple things listed here. This is what we're focusing on. So because skin is so all-inclusive, what's happening inside tends to come out on the outside, and it's related to a lot of these things. So we're gonna be looking for hormone imbalances. We're gonna look for nutrient deficiencies, oxidative stress. You can't ignore that either. Things that we get from foods, things that we get from the environment, just, everyday things. Digestive issues, huge, big topic there. Inflammation, and then of course the aging process in general. So there's things that we can still do to help you with skin problems related to the aging process.
All of this is connected, the inside, the outside, as we talk about all of this, it's just a natural progression for you.
It is.
What % do you think of the people who come in here who have digestion or other issues also have an issue with skin? Is it a significant amount?
At least 50%.
What? Really?
At least 50%.
So this is going to resonate with you folks at home.
Acne, those are the big ones. Acne, rosacea, eczema, psoriasis, those are the biggest skin issues that people complain of.
I had no idea it was that prevalent.
It is. It's very prevalent. So then the big thing about what we do here is, and this is like any other treatment program that we create here, is it's a personalized program for you. And so that includes a number of things. We're gonna focus on, depending, you're going to have testing done if it's recommended, if we think it's going to benefit us in helping you. But we're going to focus on using prescription dermatological medications if we need them to help treat the symptoms, but while also treating whatever the underlying is that we come up with. We're going to have some natural-based skincare products too. They're just kind of more of like your skincare regimen type things,
Sure.
your day in and day out. Nutritional supplements and like doing your IV therapies, but oral supplements as well. And then also aesthetic injectables, Botox and filler, because those tie into your skin a lot too, like patients with acne, right? People develop a lot of scarring, and Botox and injectables can be really beneficial for those people to kind of help smooth that scarring. So
And
it's going to
people
be a
who are 50
holistic.
people who are 51 can benefit from that. What? Okay.
And people who are 37.
Oh,
so
please. This is so exciting.
it's so exciting. I love it. I love skin. I think because it's hard and I like a good challenge. So
Well, and it's, if your face doesn't look right, it's like if your body doesn't feel right, you're not right.
Yeah.
And if you can come somewhere where you can do everything and have it be individual just to you,
yes. Right.
I mean, I love this.
Right, but it's trying to figure out like why? Why is it that way?
Right.
Not just throwing something at you and yes, it might work, but then you go off of it and guess what? You have to go back on it at some point in time because the underlying problem is still there and it's just
Correct.
going to come back. So the process is very similar of how you get in here for an appointment. It's very similar to any of the other treatment processes here. So you call the number 412-227-9255. I had to write it down because I can never remember it.
I have it burned into my brain.
I know the regular office number, so I don't call that one. So then from there, you're going to talk to our call center, and she's going to ask you some information, send you a form, you fill it out online, similar to other programs when you come in to see Dr. Dubiak. And then you're going to get set up for an initial phone consult where they're also going to gather some information from you. They're going to make testing recommendations if they feel like that's going to benefit me in helping to figure out what's going on and come up with a plan. And then after that, they're going to set you up with an appointment to come and see me. And then we're going to go over any testing that you had done, talk about your skin problems, what you've done in the past, and we're going to figure out what you need to do in the future.
I think what's fun about you taking the reins of this side of Advanced Integrative Medical 360, you have so much knowledge from your years before working here. And I think you understand what people are feeling when they come here, and they just need somebody to listen to them. And then say, we're not just going to give you a prescription, we're going to figure out what's going on, and it's okay, you're not alone anymore. The easiest way to integrativemedical360.com. They've got a great website. 412-227-9255. Make an appointment with Allie and get on to the healing ways. It's time. You're worth it. Nice job and congratulations.
I'm excited. Thanks.
We'll see you at AIM 360. Take care, guys.
Bye.